Good morning, good afternoon, good evening to all of you on the call. Welcome to this webinar, which is launching an Advocacy Accelerator report called The Impact of COVID-19 on Advocacy in Africa. I am joined by phenomenal organizations and speakers who will support us in launching this report, which is extremely timely. Our panelists today are Nana Afadzinu, who's the Executive Director of WACC, Crystal Simeone, who's the Director of NAWI, and Renee Olende. I'll share more information when I introduce them before they speak. The Advocacy Accelerator exists to strengthen and advance advocacy in Africa. And as part of our mandate, the Accelerator looked at the impact of COVID on advocacy practice in Africa last year by speaking to advocates, technical assistance providers, and donors who we focus on to understand what the challenges are, what the changes were, what the innovations were, what the opportunities were. And we focused on advocacy as part of our contribution to the political agenda of supporting and protecting civil society in Africa. Our report was complementary to other reports that were released. For example, from EPIC Africa and from Civicus, that was a global report. And our focus on advocacy enables a lens to shine on change makers on the continent. The objectives of the study were to understand the extent of the impact of COVID on the ecosystem in Africa, and to understand how adaptations had taken place for advocacy to continue. Because as we all know, during COVID and as COVID continues, advocacy is needed now more than ever and continues to be an important pillar in the different actions that civil society take on the continent. As we launch the report today, we are going to hear from Donnelly Mwachi, who will present the results of the study. We will then hear from our remarks and thoughts and reflections from the three panelists who come from different spaces within the advocacy ecosystem on the continent. So without further ado, I would like to welcome Donnelly Mwachi to present the findings of the report. He is the Monitoring, Evaluation, Research and Learning Lead at the Advocacy Accelerator. Donnelly has over 20 years of experience in the advocacy space, focusing on monitoring and evaluation. He has been with the Accelerator from the start of the Accelerator, and he brings a wealth of experience looking at how to measure advocacy on the continent. Donnelly has worked alongside working in Africa. He's worked in Asia, South America, and Eastern Europe. He has extensive experience with organizations such as IDRC, CEDA, FCDO, NEPAD, and the EU. And ultimately, he is extremely passionate about M&E for advocacy, M&E for capacity building, and M&E for research and development. Donnelly, over to you.
Thank you, Claire. Maybe I will ask Irene to state the webinar norms before I go straight to the presentation. Go ahead, Irene. Thank you.
Thank you, Donnelly. We thank you for coming for our webinar and honoring our invitation to this relevant conversation that we need to have. COVID-19 has actually affected all of us in one or the other. As we start this launch event, we want to be on the same points and the norms that we're going to observe as we're going through discussions. One, we respect your time and availability in view of COVID-19 uncertainties. And therefore, we thank you for coming and we will honor your time. Secondly, please type in your questions and comments on the question and answer box, and we will get to that during the panel session where we'll address your question and also read your comments, the comments that you will have put through. Our panelists will use their videos and microphones. All attendees on mute. If you wish to speak or ask a question live, please raise your hand and the moderator will unmute your microphone. Let's be respectful of each other's opinions, and we're all knowers and keepers of information. So let's respect everyone who brings out an idea or a point or a comment during this time. We have been able to provide interpretation services for you. Branley and Margaret will be translating this session live. Please look at the bottom of your screen and you'll see a global map. Here you can click. You're requested to select the language of choice in language interpretation tab, which is that global icon. Please stick to the language and only speak in that language. In that, you'll get a very good experience throughout the 90 minutes that we shall be on air. And secondly, the presenters and speakers are requested to use video only when speaking and turn on your microphone only when presenting. Otherwise, please mute. I wish you a wonderful experience during this particular webinar. Welcome, Donnelly.
Okay. Thank you, Irene. Kindly allow me to share my screen. Thank you. I will be taking you through the findings of the COVID-19 report. First of all, I'll start by explaining what was the purpose of this particular study, and of course the methodology that we took in conducting the study. Starting off with the purpose, the main purpose of the study was to understand the extent which COVID had affected, or rather has even affected the work of advocates and technical assistance providers in Africa, including donors, and also to understand how advocates and TA providers have been agile to adapt to the new normal resulting from the pandemic. This particular study took place in June, between June and August last year. And of course, like I mentioned, it targeted advocates working in Africa, TAs based in Africa, and donors supporting advocacy work in Africa. So looking at the data overview, we fairly received about 156 respondents. That is around 114 advocates who participated in the survey, and 33 TAs and 9 donors across 29 countries in Africa. If you look towards your extreme left, you'll see the distribution or the spread of the respondents that we were able to get their response from. If you look at that particular distribution, you can actually say that it was a fair distribution of responses, despite the sample size being quite
okay, I'm in a meeting, but you can go. Yeah.
Despite the sample size being quite fairly good enough. So we had 31 respondents from the Francophone countries and 125 respondents from the Anglophone countries. And out of all the 156 respondents, 83.9% were from the national and grassroots or local, or rather they conduct advocacy work at the national and grassroots level. And majority, which is almost half of the respondents, were actually conducting advocacy in the field of SRHR and health in particular. So we'll start off our findings by looking at what were the findings from the advocates, what were the findings from the TA providers. Looking at the findings from the advocates, we asked them whether they were still conducting advocacy despite the pandemic, and 63% reported to be still active in advocacy despite the pandemic, and they were actually engaging with the general community, policymakers, and decision makers via online engagement. online media engagement as well, issues to do with youth advocacy and policy interventions, among others. Looking at the demographic that I presented in the previous slide, you can actually see that majority of our respondents were actually from the SRHR and health advocacy. And basically, so many of the issues that they were still advocating during this particular period were mainly on SRHR and health related advocacy issues or asks, so to say. Moving forward, we also wanted to know whether the advocacy focus had shifted to accommodate COVID-19 emerging issues, and 75% reported to have shifted their advocacy activities to accommodate these issues. And some of the things that were mentioned as a shift, one of them was that they had revised their advocacy plans to accommodate government directives on COVID-19. Some reported that they'd changed their methods of engagement or delivery, which we'll be looking at that in the later slides. 53% reported to have shifted towards online advocacy. And then, of course, there was also much focus, for those who are not in the SRHR and health field, there was also much focus on doing advocacy around food security, livelihoods, among others. And of course, also there was also a shift towards health advocacy. I think I mentioned that, and there also maybe just to mention issues around advocacy that addresses teenage pregnancy, gender-based violence, among others. So we also wanted to understand the challenges that they were facing in advancing the advocacy issues during this particular period. And we tried to do a comparison between the Anglophone and the Francophone respondents. So one clear factor that was that came out very strongly was that there was an unfriendly political and social economic context, which was actually not favorable for most of the advocates to push their advocacy agenda. And you can actually see that was quite strong in the Francophone countries as compared to the Anglophone countries. They also reported limited ability to monitor and evaluate progress of advocacy work during the pandemic, considering that most of them had shifted towards online advocacy, and majority who had reported that they do not have expertise in conducting online advocacy. Again, we'll also be looking at that in greater details in the later slides. There's also a section that reported that donor priorities have shifted, hence affecting their funding in one way or another. There's also reduced support from coalition and networks, lack of technical support from technical advisor, and some of the donors as well. There's also lack of access to the right information and materials to further advocacy work. I mean, if online advocacy is your new area, of course, then you need the resources, the skills, and the training to be able to conduct effective advocacy online. There was the lack of capacity to continue the advocacy work online, of course, which is tied to my previous point, and the lack of interest from advocacy targets and the media in general, which is also slightly tied to the previous challenge that was mentioned around the unfriendly political and social economic context. And then lastly, there was lost momentum and morale to advance the advocacy issues during this particular period. So comparing across both Anglophone and Francophone, you can actually see that in some of these particular challenges, some are quite predominant in the Francophone countries as compared to the Anglophone countries. Further, we also wanted to understand if there were any new practices which have been embedded in the advocacy work during this during the pandemic, and from the findings, you can actually see that around 46% of the respondents reported to have been agile in one way or another. So the use of online platform, for example, Facebook, Twitter, Zoom, use of radio and TV was quite predominant, where 61.2 reported to have shifted towards online platform. Around 41% reported to have limited capacity to adapt to new emerging practices completely. 32% reported to lack access to awareness or necessary information to implement new approaches. and around 5% cited lack of interest from advocacy targets and media regarding innovative practices. I think that's a repeat from the previous slide. Sorry about that. So we also inquired whether they've been receiving technical support during this period to advance the advocacy work. And around 74% reported to be receiving technical support. You can see there's a lot of technical support in the Francophone countries as compared to the Anglophone countries. And some of the TA providers who were mentioned to be providing TA during this particular period have been mentioned towards your left. For example, we have UN Women, we have Handicap International, HAMREF, Shuja, LVCT Health, Mama Cash, among others, that is in the Anglophone countries. And also in the Francophone countries, we have IPPF in there, we have DRC Peace Building Support Office, which was mentioned, Evidence for Action, Joint Commission International, among others. So these are just some of those TA providers who were mentioned, during this particular survey, and there could be more. So we also wanted to understand the specific training they'll be interested in to support the advocacy work. And if you look at the Anglophone region, the M&E for advocacy, and with a special focus on measuring the impact of online campaigns, impact of media advocacy, doing outcome harvesting online, was one of the areas that was actually mentioned by these particular advocates. Resource mobilization, considering that some of the funding had been affected. Conducting policy advocacy online, how to conduct advocacy during a pandemic such as COVID, this being a new context to many of the advocates. Doing community mobilization during the pandemic, considering strict government rules and regulations that have been put in place. How to engage advocacy targets during a pandemic. Conducting health advocacy, online advocacy, budget advocacy, among others that have been listed in there. So if you look again in the Francophone countries, human rights advocacy was reported to be a predominant area that they would like to be trained on. And again, here we also see M&E for advocacy, evaluating online advocacy interventions and how to conduct online advocacy intervention, resource mobilization, also the same as Anglophone countries or advocates, how to effectively engage advocacy targets during a pandemic. Again, that was also mentioned on the other side. There's also feminism and gender, which didn't come up from the Anglophone side, and how to conduct peace campaigns online during the pandemic. So we also wanted to understand whether the funding had been affected. And from the findings, we can actually see that 84% of the advocates whom we interviewed reported that their funding had been affected. And the extent, comparing the extent which the funding was affected across region, you can actually see Anglophone countries are more affected as compared to Francophone countries. And they reported that around 65.9 reported that fundings had been redirected to COVID-19 activities. 29.6 of the 84.2 reported that funding had been reduced completely, and only 4.5% reported that funding had been increased. So other funding challenges that were also reported include donor delays in fund disbursements during this particular period. Some of the donors feeling like there's minimal work being undertaken during the COVID-19 period, and hence, of course, delays in terms of funding disbursement. Escalating exchange rates, of course, during this particular period. We all know that these have actually affected many countries. Withholding of donor funds due to failure to implement activities due to the stringent country rules that have been set as a result of COVID-19. So now we look at the findings from the TA providers that responded to the survey. And in this regard, the TA providers were defined as advocacy research and evaluation consultants. This could be individuals, organizations. as well as think tanks, INGO or NGOs who provide training or capacity building to CSOs at the local level. And from the findings, like I mentioned earlier, we had 33 respondents, or rather TA providers who responded to the survey, and 29 were from Anglophone countries and 4 from Francophone. And most of these particular TAs, again, just as compared, I mean, looking at also what we had in the advocates data overview, most of them provide advocacy TA support around SRHR and health, education, climate, in that order. I think if I repeat. So some of the TA providers that responded to the survey were from AIDS Fonds, Akili Dada, Association, that name, the French name, Violence, Bakamoso Gifts of Destiny Center for Empowerment. We have HINET in there, we have Moli, we have PL, we have University of Nairobi, we have Y-Act, among others. So all these teams have actually been listed in the report if you want to have a look at those ones who responded to the findings. Now, the first thing you wanted to understand is whether they were actually facing any challenges in administering TA services. And you can actually see 87.9% of them reported to be facing challenges in providing TA. That is around 62 or 63% with majorly impacted, and 29.2 who are moderate, moderately impacted. And we also wanted to understand the kind of TA support they are providing during the pandemic. And 47.8 reported to be training advocates, and also around the same figure, also providing advisory services to advocates. And 4.3 were active in doing advocacy research and evaluation. We also wanted to understand whether they've been agile to accommodate the new environment, and we found out that 63.6 reported to have changed their ways of working. And just like advocates, most of them had moved towards online digital platforms such as Zoom, Skype, Facebook, WhatsApp groups, to engage with the advocates in delivering their capacity building interventions, or even partnered. Even some of them even partner with grassroots or local organizations who have access to the communities, or even using print media tools to reach advocates who have no access to the internet completely. Around 55% were active in terms of providing TA services, and they also reported to be packaging and disseminating information to paralegals on SGBV, building advocates' capacity on prevention methods and how to engage with policymakers and decision makers during a pandemic, and support CSOs in resource mobilization, which is also a key area that advocates reported that they lack capacity on, and of course, due to the impact that COVID had in terms of reduced funding of their activities, translation of content from French to English, etc. We sought also to understand who are some of the funders who are funding the TA providers, and we have the Dutch Ministry of Foreign Affairs, we have BFW, who are mentioned, IFAD, APHRC, MSH, FCDO, FDO, formerly known as DFID, USAID, and AMREF. So what do we make of the findings? It's quite clear that despite the political and socioeconomic uncertainties that have been brought about by COVID-19, advocates have remained active in their practice, and they're still conducting advocacy work in their areas of expertise. And we can also see that most of the advocates have been agile and resilient to adapt to the changing political and social economic situation in their countries. It's also evident from the finding that there's also reduced technical capacity to conduct advocacy work online, and conducting advocacy online being one of the areas which is quite new to most of them. There is also need for them to be trained on how to effectively conduct and also monitor the online advocacy intervention that the advocates are also doing. The tier providers and donors, there's also need for the tier providers and donors to continue building the capacity of advocates, and also for donors especially to continue funding advocacy interventions and to address some of the things that have been mentioned as challenges by advocates in regards to late disbursement of funds, have discussion around the exchange rate issues, continue supporting TS to effectively continue providing TA support to advocates in Africa. Thank you. That's all for me.
Thank you very much, Donnelly, for that comprehensive summary of the report. As the accelerator, we are very excited to be able to contribute to the strengthening of the African advocacy ecosystem with this report, but more importantly, how we support the advocacy sector going forward by sharing this information. It speaks to the role and mandate of the accelerator as a think tank, as part think tank, part innovator, part connector, and part service provider. I have been asked to apologize that we were not able to provide sign language. This was a request that was made by participants prior. And secondly, I had not introduced myself. My name is Claire Matonsi. I'm the Deputy Executive Director at the Advocacy Accelerator. Going forward, as part of this agenda, we have invited 3 different organizations and stakeholders within the advocacy ecosystem to share their remarks about the report and also to give us some insights and thoughts on gaps, but also innovations and solutions to some of the challenges that we are seeing. It is clear that the new COVID-19 context has exacerbated the problems that already existed for civil society organizations. Civil society advocacy organizations, networks, and individuals have been forced to forge new ways of working, review their processes, recast their strategies, and potentially restructure themselves and their operational models. It is in this context that I would like to invite our first speaker to share her remarks from an advocacy advocate perspective. I would like to introduce Crystal Simeone, who has 10 years of experience working on macro level inequalities. She currently works on women's rights and macroeconomic policy at continental and global policy spaces. She champions for and works with women at all levels to be able to influence, analyze, deconstruct, and reconstruct macroeconomic policy decision-making through an intersectional Pan-African feminist lens. She is currently an Atlantic Fellow, and also Crystal leads AfriFem Economics Collective, which is an exciting initiative that is bringing feminist analysis to macroeconomic policy. Crystal, over to you. You're welcome.
Thank you, Claire. What an honor to be here on a really nice day in Nairobi. It's, I think, one of the very first webinars I've been on this year, and so a really great start to the year. So thank you for inviting me. Thank you for holding space for these really important conversations, but also for doing the work that not many people in the trenches doing the actual advocacy work are able to do, and make sure that this sort of information is available, not just for us, but for the donors that support us, and for advocacy, policymaking spaces as well. So it was really interesting, and thank you so much for giving us an overview of the findings. It was really interesting to read through them, and I really liked what you said, that CSOs, what's happening has only exacerbated the problem that already existed for civil society. But I think for the world at large, and many people think that COVID created a lot of these problems. So what it's really done is really just shown the soft underbelly of a system that doesn't work for many of us, especially on the African continent, but also doesn't work, a system that doesn't work for advocates that are coming from the global south and that are coming from Africa. And I think the report really brings out some of these very glaring gaps in a way that puts a number to it and makes it feel and seem a lot more tangible around issues that we sort of think are there, but maybe sometimes think we're the only ones in the space, but also are not able to reach out to make sure that we have the evidence in a way that can present a case that this report so well does. So it was interesting to see. I think the most interesting bits for me were, and Claire, please just say something when I'm close to time. I don't seem to read the notes. I wouldn't see that, so just interrupt me if I'm going over time. So the first statistic that was really interesting was 63.2% are still conducting advocacy, and that 54.3% are conducting online advocacy. And that's really interesting. And I really would like to have a conversation based on this around quantity versus quality. So yes, we are doing the advocacy work and we are online, but really in terms of quality, and I guess this speaks to the M&E and the monitoring and the learning from what this means. What is it actually? Last year, we spoke at the Tana Forum, and this is a safe space, I assume. And it has, Africa's premier decision makers, there's president, heads of states, there's policymakers at different levels present there. And we had this session on the Africa Continental Free Trade Agreement. And in terms of advocacy, M&E, we're sort of hitting boxes there, like it's a great space. We're speaking to the people that we should be speaking to. But as the camera panned across the room behind the Zoom cameras, nobody was really listening. We didn't get very many questions. People seemed to be doing their own thing. And even online, everybody's camera was off. So it had me questioning, how impactful are we with these online versions? And I like to say, we can't go back to normal because normal was the problem. And I think that is a question that comes back to us as advocates. We can't go back to normal because normal was the problem. And the way that we work things also has to change. So are we just replicating a way of advocacy and putting it online? And how do we make sure that it's actually working? Or are we just making sure that we're there so we can tick off boxes when we're reporting to say that we did the work? And so I'm just sharing the thoughts that have been going through my head in the last sort of 2 or 3 months. It also says that 90.5% of respondents are interested in learning how to conduct online advocacy. And I really wonder what that means and how organizations that are able to be in spaces like this are acting as gatekeepers. I wonder my role as a gatekeeper and not being able to pass the microphone to people who should be actually doing the speaking. And when we go for, global events like the CSW or African Union events, we're able to, fundraise and make sure that, we're paying for tickets for people to actually be in those spaces and speak for themselves. And what happens now when, there's very many people, women who don't have access to laptops, for example, who don't have access to data plans that are able to put them online, or even if they do, the connection is so bad, trying to hear them is such a challenge. I just got off a call planning for a project that we're doing with partners in Zimbabwe, and our Zimbabwe partners were just not able to get on the call for about half an hour, and when they did, they just couldn't hear. So yes, we are online, but are we really online, and are we really connecting with each other is something that I don't have answers to, but definitely this report really brought up those questions for me to think about. And how do we measure it? And I've said this before, how do we measure presence? Yes, but meaningful presence and what that means. And it sort of felt like the mad rush to get on webinars all of last year. And I think that's in part a way to feel like we're doing something and not just being quiet, but contributing to something. But I think now, as we go into this year, and it doesn't look like the pandemic is going to ease up, especially for the continent, especially with no vaccine in sight for us. What does that really mean? And I also wonder about taking advantage of new measures, new modes of communicating. Does it always have to be Zoom? Does it always have to be, webinar over Skype or whatever? And I was looking at some statistics last night as I was preparing for this, and everybody's talking about TikTok. The digital media people that we work with are always talking about TikTok. I had to get on TikTok because I don't know what this monster is, and I don't think I'm the target audience. But really, 800 million users worldwide are on TikTok, and 41% of those are between 16 and 24. And out of those users, they are on TikTok for an average of 52 minutes a day. That's a lot of time. And I wonder if we're able to broaden out what our virtual engagement and what our virtual advocacy looks like, with young people spending, copious amounts of hours on this monster in my head called TikTok. And I've seen videos of, young people explaining the law, the legislation around, traffic offenses and what that means. And I wonder whether we can be doing the same when it comes to sexual reproductive health and rights or economic justice in the realm that I work on. Yeah, so that's just questioning if there's any other spaces that we can think of when we talk about virtual advocacy, because for so many of us that just rings a bell in terms of webinars and Zoom calls, but maybe we could think a little bit out of the box. And that really, the report really brought out those questions for me. And lastly, I think, and this was definitely probably not the point of the research, but it was so stark for me, the difference between Francophone countries and their experience with advocacy and Anglophone countries. There's so much less technical assistance, there's so much less funding available for them. And it's something I've sort of thought about, but not really had anything present or presented to me that shows a very solid case with numbers. And I think as much as this really wasn't the point of this report, it was so stark for me. And I think there's definitely room to do a lot more research in terms of the difference between Francophone and Anglophone countries, but also with Lusophone countries. It made me wonder what happens to Mozambique and to Angola and Cape Verde when it comes to advocacy. And definitely for me, it makes me want to make sure that I'm inclusive enough, making sure that I have translation and interpretation with all the work that I'm doing. So for me, that's one of the biggest points of impact. So just again, it was measuring what quality advocacy looks like online, what online advocacy looks like and how it's evolving, and whether we're on that bus of evolution as well. And just really pushing me to think a little bit out of the box. And as was said in the first presentation, what does monitoring and evaluation and learning of virtual advocacy even look like? So I'm really excited to hear more from other panelists and see what their experiences are, but also really excited about this report and really excited about the questions that it's eliciting and the connections of work that it's going to be brokering. I will stop there.
Thank you very much, Crystal, for your insights. I'm particularly moved by the points you've made about normal was the problem. And we have so many advocates working in many different sectors, doing many different things, and we don't always come together to have discussions around the systemic challenges that we do face being involved in the sector. I also appreciated the quality versus quantity. As the accelerator, we speak to many advocates, and many have said we're doing digital advocacy, but when you ask what that is, they're talking about the tool, so the use of Zoom as opposed to a strategy. So are we able to try and be more effective in this new context that we're operating in? And then obviously the divide between Francophone and Anglophone. As the accelerator, we're a Pan-African bilingual organization, and it is astounding when we see the differences, but also the limitations we have in learning from each other, as opposed to Francophone being seen as a consumer of what happens in Anglophone. There's a lot to learn, there's a lot of solidarity, there's a lot of peer-to-peer learning, but the context of colonialism, the context of the way we operate now prevents those engagements, and we've got to do a lot more. Apologies, that was your alarm. So thank you very much for that, Crystal, and I look forward to discussions that will come out of this. You did touch on some of, and responded to some of the questions that we did receive prior, which is appreciated. We are going to, I'm just going to remind those who are listening in, please do take the opportunity to type in your questions. We will have a discussion period at the end. We are also responding to the questions that were shared with us in advance. And as always, please do use the hashtag and tweet. I would like to move on to our next respondent panelist, if you will, who's representing technical assistance providers. I am excited and delighted to introduce Nana Afidzunu, the Executive Director of the West Africa Civil Society Institute, WACSI, which I'm sure many of you have heard of. WACSI really charts a path that many of us who are in the sector are trying to follow. Nana is a passionate advocate for sustainable development in Africa. She has passions around leading for change and challenging the status quo on the continent. She has received many accolades. One is the Advanced Media 2020 100 Most Influential African Women list. Nana is a lawyer by profession. She's worked in diverse sectors such as governance, human rights, philanthropy, and capacity building. And she's also worked and been part of organizations such as the Open Society Initiative for West Africa, ASIWA, IBIS West Africa, and the African Commission. Nana, I'm going to stop there because your biography is extensive. You are welcome. Please share your reflections and your remarks. Over to you.
Thank you so much, Claire, and thank you, the Advocacy Accelerator, for this invitation to have a conversation about the issues that the report has really highlighted. I want to say that I think that the report really confirms on many levels several of the issues that we are facing in this space as advocates and as technical assistance supporters or providers to different civil society individuals and actors and groups that work in this space and pushing for the issues that we are all concerned about. Now, let me just share for us, I mean, speaking to the report and the highlights, particularly when you look at the issues related to TA providers and what they have stated from the research that was done. But I want to say that it really speaks to a larger or a broader picture, which is a certain lack of support for strengthening the capacity of civil society organizations and advocates in the global south, particularly, that enables their effectiveness and their efficiency, their sustainability and their resilience. So the lack of investment in this meant that when the crisis hit, several organizations really struggled to withstand it and survive. And those working on advocacy projects, advocating on critical issues were, of course, also caught in this web. One, the impact of low-tech capacity, and when most of the world is forced to work online because of lockdowns and restrictions on physical engagement. And we know that particularly when it comes to advocacy and advocating in our region, there is a lot of physical engagement you know, and so that in itself, the fact that that was no longer possible, particularly when we had the lockdowns, was very challenging. Challenges with flexibility in the work that they were doing, the partnership frameworks that they had with different donor partners. That was challenged because for a number of donor organizations and these partnerships, they were so restrictive, you know, straight-jacketed, that you could not even try to change what it is. And particularly if you are looking at advocacy, sometimes the challenge is that you have certain milestones that you are supposed to reach. And with the COVID and everything, there were some of these donor partners that were not, if you were not going to shift this to address something that was COVID-19 related, then it became challenging. And it's not in all cases that you had advocates or advocacy organizations that could do that. The durability of projects. So for several organizations, apart from the lack of flexibility in the project framework, it's also short-term projects. You don't have long-term projects, and so this was also challenging, and having the kind of support that was needed, consistent support, was a challenge for several of these organizations. They are living hand to mouth, and therefore they have to implement projects before they can even, through the projects that they get, have the kind of funding that they need to support their organizations and the operations that they run. So it was clear when COVID hit that for several of these organizations who did not have any kind of endowment fund, they did not have any kind of reserves that they could fall on, and they could not implement their projects because of COVID, and the fact that they needed this physical engagement, they were very, very challenged. And so the kind of support that is needed, and this is what the report highlights, and I think it's important, is one that focus or attention needs to be brought to. And I'm happy that we have partners here, particularly donor organizations that are listening in and would recognize the need to really support our institutions on these issues. With all this going, there were still key issues that needed attention. Organizations, particularly advocacy organizations, were working increasingly within a certain shrinking civic space. Some of them, and there were a few arbitrary arrests and targets of civil society leaders who were advocating on several things. When many of us were forced to work online, digital insecurity became a major issue, repressed press freedom. And so even when the media was one of the ways in which you could then get the messaging out, there were challenges there. Weak legal and constitutional systems, restrictive legislations during the pandemic, also a weak solidarity system among CSOs. And so we talk a lot, even as advocates, about networking and coalition building and all of that. But one of the things that came out during the pandemic was really that we were not in actual fact really working together the way that we needed to. And so this was important. And of course, the inability to meet, strategize, and engage physically. So some of the things that were done, I mean, and I can speak from Waxi's example, some of the different things that technical advisors were pushed to do, or those who build the capacity of advocates. Redesigning advocacy capacity building programs to fit online engagement. So a number of things that were done, looking at how can you advocate online, how do you do it, how do you improve it, how do you reach the target audience and the stakeholders that you want to meet and change the agenda. How do you do that? How do we build our networks better? Looking at human rights training, digital security training, How do you use, what kind of technology do you use, and how do you use it? So these were some of the areas that were addressed. Fostering partnerships with other advocacy organizations, even for virtual engagement, responding to advocacy issues, Civicus, Africa Rising, Africtivists, and others, to really respond to advocacy issues, increasing advocacy deliberations and actions online via webinars, communiques, letters to policymakers and duty bearers. These were some of the things. Accelerating social media platforms for advocacy so that you can mobilize, build solidarity around issues, producing policy briefs, creating regional virtual platforms where advocates and civil society activists could constantly share updates and engage on some of the key issues that arose. And for West Africa, things like what happened in Mali, some of those challenges were there. But even with this, there were challenges. One, moving capacity building support online when this has been done physically for a very long time, redesigning training models so that it can fit virtual delivery. And there are certain things that is even more challenging to do because, as you know, capacity building or technical assistance, it's not just one-off. You could have the one-offs, but there's also the coaching and the mentoring, and it really takes time. And sometimes doing it physically is helpful, but it had to be pushed online. You were compelled to do it because of COVID. So this is one of the challenges that had to be faced. Mobilizing support for advocacy engagements using virtual meant that there were certain challenges. The low technology and digital capacity and skills among civil society advocacy partners made it very challenging for many of them. And there are examples where you have meetings, and I think that Crystal mentioned one meeting where she just had where people could not even join because they were having challenges. Access to data, the cost of data, all of those things. Even having the hardware, not only the software, but even the hardware to engage is challenging. It has been challenging. And of course, the resources, the human and material resources to drive advocacy work. And so how have these challenges been addressed? Strengthening and leveraging partnerships. I think that is one of the critical areas. Redesigning training programs, upgrading digital school tools and skills for online engagement, using social media especially, and working with the media, traditional media, re-engaging donors to repurpose funding where necessary, and to understand the need to support technical assistance on a long-term basis now than before, which is one of the challenges that technical advisors have faced for some time. Now, I think it has been appreciated how much that is needed. And then, of course, building our own capacity as technical advisors to ensure that there's a maintenance of high quality of service online and offline. One of the things that the pandemic has done, though, is that it has given, working digitally has enabled a wider outreach. So it means that being able to run programs in different languages, and for WACSI, working in West Africa, particularly French, English, and even Portuguese. And in one of our trainings, we even had Spanish. So those are some of the things that have been very helpful. That's one plus. So we've been able to reach a wider group of activists and civil society actors that need that kind of support. But as we speak, the biggest challenge, I think, is that many of our groups and organizations that are doing advocacy and doing good work on the ground do not have access to technology. And so we still have to find a way where they could also have the kind of supports that they need to do their work. And so, for example, there was a program that we had in Liberia recently when the restrictions were eased. The fiscal meetings allow for a greater interaction. They allow for flexibility or in the time delivery of content, you know, and close to 90% of participants that we engaged were not tech savvy. They did not even have emails. These were community-based organizations. So they just could not engage virtually. So we need to be looking at how we can support groups like this. And that is one of the biggest challenges that we face. WAXI works with other organizations to advocate for more support to really get technology to the grassroots in our different countries. But apart from that, we have to look at how do we, for example, use mobile technology because we have a very high rate of mobile or high percentage of mobile technology penetration. So that is one of the areas that we could look at, but there should be other ways, traditional ways of engaging and messaging using some of the things that we've already been using in these times. Now, even if you want to look at fiscal meetings, suitable locations where you can have that kind of social distancing that is needed, adhering to the COVID protocols and all of those things. These are some of the things that we really have to pay attention to and build a strategy around. Otherwise, we will be leaving a huge number of organizations that need support to be able to advocate within their spaces at this time. That being said, I would like to say that I think that the report really does confirm on various levels the key issues that attention needs to be paid to, and I want to commend the Advocacy Accelerator for this. Thank you very much.
Thank you very much, Nana. I'd really settled in and was listening quite intently and agreeing with all that you were sharing with us. And I really appreciated the perspective of technical assistance providers because we don't always consider that voice, yet they're such a critical part of how change happens and how we support organizations to drive change and implement their advocacy agendas. I think for me, hearing you speak about the assumptions we make about living in a digital world and what it means to shift our work into digital spaces and looking at digital insecurity, which is, we tend to think of the tactics, but not so much about the security. And for many organizations, what that means and how to do that. Access to technology being another one, but something that really touched me was the weak solidarity systems. And we see other sectors have really lobbied governments for emergency crisis packages, the private sector being one, but civil society, we're yet to see one. And what does it mean for us to have solidarity to strengthen and support the sector? Because as you said, many organizations were hit hard and not prepared. And in that, we lost a lot in key policy moments on key advocacy issues, because we know these organizations will not be able to survive what is currently happening and the challenges around funding. So thank you very much for your thoughts and your remarks and your appreciation of the report. I look forward to hearing some of your responses to the questions that will come up. I am going to move on to listen to, always it seems the most listened to section on any meeting, and this is the voice of donors. We are very appreciative of SIF and Renee Olende, who has joined us today She is part of SIF's Africa leadership team and is responsible for the strategic engagement and communications component of programs. She has 15 years of experience and is a passionate strategist with a track record of delivering strategic integrated campaigns at multiple levels. Renee has worked in diverse projects across Africa in the realm of the rights of women and girls and safeguarding the environment and research and development, which is critically important at present as we look at vaccine inequality, which we've seen exacerbated through COVID. She has a background in communications and public administration. Renee, you are welcome. Over to you.
Thank you so much, Claire. Such a pleasure to be here. And one of the most beautiful things I would say about this particular forum is that it gives us an opportunity to build forward. So in terms of how I'd like to frame our conversation today is, I'll start off by introducing the Children's Investment Fund Foundation, because I appreciate that there's some people who are part of this amazing webinar that might not know about SIF. And then focus more so on how SIF and our partners pivoted when COVID struck Africa. And to the points raised within the report around continuity when it comes to supporting advocacy, capacity building, and the need to have continued support for civil society around areas of research and monitoring and evaluation. I'd like to speak on how SIF is looking at the future and what are some of the things that we'd be very keen to supporting. So let me start with the first to just share that, SIF is the world's largest philanthropy that focuses specifically on improving children's lives. And we were established 18 years ago. We're an independent philanthropic organization with offices in Addis Ababa, Beijing, London, Nairobi, and New Delhi. And so seeing that we're not implementers, we work with a range of partners and we seek to transform the lives of children and adolescents. And partnership is very critical in our work because it will make us have a more combined effort, make sure we have a very strong sustainability arm. In Africa, we lead with the framing, which is for Africa by Africa. So local solutions to local challenges. And more so our bandwidth is around children and their families and how they live their lives every day. We have no religious affiliation or political affiliation. Our programs are designed to support and build on existing work, and we believe in bold ideas to solve seemingly intractable problems. So if we were to look at COVID and how everyone had to pivot, many development partners, SIF included, had to deal with national lockdowns, banning of public activities, and to the points of my fellow panelists, you couldn't have that face-to-face engagement that advocates, civil society are really accustomed to. So some of the things that we did, and I'm just going to speak about 3 of our programs. We have an amazing one that looks at girls' opportunities, and this is keeping girls in schools. And so what our partner decided to do was to actually embark upon online advocacy forums. And this is the Zoom workshops that have been mentioned. But more so, it was important because we got to actually get traditional and religious leaders to actually speak into these online engagements. And that was new. And some of them were actually based in not such urban areas. They were in peri-urban areas in both Ethiopia and Nigeria. And around our work that's focused on water, sanitation, and health and NTDs, our work in Ethiopia was quite interesting in terms of how we pivoted. We really harnessed the power of brand ambassadors and used arts and culture to actually shift the narrative around hand washing and latrines through use of music. And these messages reached rural and semi-urban towns. And it was quite positive to see the feedback in terms of the reach that we were getting. Secondly, I'd like to speak about how we reached children when it came to hand washing. And we, working with our partners, of course, with the implementers, they came up with this great idea of virtual reality 360 degrees videos to reach school-age children. And it was all about appropriate hand washing practices and behavioral messaging. And I thought that was quite an interesting strategic communications ploy using these brand ambassadors and key influencers. I think the last example I'd like to land with, because I want us to create time for more discussion, is our work with child health and development investments. So we leveraged digital tools, and our partners pivoted by using this method through TA, and this involves training, site supervision, and essentially having our project staff start to use telephone check-ins, especially for mothers who could no longer go to the district hospitals just because of exposure to COVID. And so it actually proved quite a resourceful approach to work, and also training using telephones and digital platforms such as WhatsApp. So what does the future look like? And I think this is where a lot of the conversation is leading towards. What are some of the things that donors are looking at? And I'll speak about SIF specifically. So at SIF, we're very big on being movement generous. And what this means is leveraging local experts and partners to drive investment-related advocacy asks. So in this way, SIF is keen on sustainable development that is African-led. And so I love the fact that the Advocacy Accelerator is bringing together lots of local experts and partners who SIF could in the future work with. More to that is advocacy is a critical component of our investment design. And so I've heard people speak about, we need to get more funds supporting advocacy efforts. One thing that we see is key around the message that one of the panelists mentioned, I think it was Nana, around the need for civil society to come together more. We are very keen on embedding strategic policy priorities and advocacy approaches through cross-sectoral service delivery programs. This means that civil society does not go at it alone. It works hand in hand with service delivery programs. This allows for integrated approaches that address systemic challenges. And this complements the work that's happening through strategic communications and advocacy, which I think is the way to go, looking at things from a very collective lens. Lastly, I'd say, well, the two last things I'll say is, we need to measure what matters. And I love that that's a very significant part of this report, noting that social change does take time. And I know funding for the most part has looked at very short periods of time. And so some of the funding options will need to shift to enable civil society actors to implement for the long game, for long-term impact. So investing in big bets, which is looking at a five-year time horizon, and looking at new normal approaches to work, presents an opportunity for all of us. And this also allows us to show evidence that helps build confidence for advocacy when it comes to the impact that advocacy initiatives do achieve. And I think the last thing I'll speak about, which I'm excited about when I was talking to one of the members of the Advocacy Accelerator, is this idea of a community of practice model that enables cross-fertilization, coalition building, and knowledge sharing. And I think this is something that should be harnessed, and more donors should really put more effort in supporting these kind of mechanisms and structures. This also includes enabling young youth-led social accountability and community engagement, to the point that when COVID hit, it was all about webinars. Let's have a webinar happen. However, I think the pivoting this year and beyond should look at new ways of actually having local iterations of this work, and capacity building is key. An integral approach of designing solutions is actually having a youth-centric, community-inspired models. So when we consider the face of advocacy, we should give key stakeholders and beneficiaries a seat at the table. And I think the more we start to look at it in that way, not feeling that we have to be the bearers of the solution, but having those who are on the ground actually speak for the issues when we're not in that space is going to be really a huge game changer. So I'm very big on community of practice and local capacity building for this sake. So I'm going to leave it there and open it up for questions. And thank you very much for creating this space. Over to you.
Thank you very much, Renee. As I said at the beginning, it's not always easy to speak as donors, but there's a lot of positivity in what you shared and great linkages to the inputs from the other speakers. One of the calls to action in the report is that advocacy continue to be funded, because we know that advocacy gets deprioritized and defunded very quickly. And to hear that CIF has it as a priority going forward is fantastic, but also we know that within the donor environment, the influence that call will bring is critically important. I also appreciated the point you made about social change taking time. We know that advocacy is uncertain, and there is a study that the Accelerator has done that we're releasing later this year, looking at donor behavior and how majority of organizations receive advocacy funding as project funding for short periods of time, as opposed to supporting advocacy as part of organizational effectiveness over a longer period of time. And so great to hear that. And also the point you've made about local solutions and how we showcase and bring attention to Africans as not as subjects of advocacy strategies from the North, but rather as advocates who are innovative and coming up with locally driven solutions that speak to the context, and really trying to see how we support that there's greater funding of locally driven advocacy as opposed to donor driven advocacy. So that was great to hear. Also, lastly, this call around supporting coalition building and knowledge sharing, critically important. It's a theme that has run through from Crystal to Nana and yourself, and it's something that the Accelerator does focus on and look at. So thank you very much for your remarks and your thoughts, and also just giving us futuristic aspects to think about and to consider as we continue doing this work and supporting the advocacy ecosystem in Africa. So I'd like to thank all three of our panelists for their remarks and their thoughts shared with us. All extremely insightful and a lot to think about. So much was said that we could have a webinar on each of the thoughts shared by the panelists. So thank you very much for that. We are fast running out of time, and I would like to open up for questions. We have received some questions from panelists on this call, but also questions before. So I'm going to ask the panelists to share reflections as the Accelerator. And I think it was Renee or Nana who said it. We don't always believe we have an answer, nor do we present ourselves as having the answer. And part of these discussions is to raise and inspire and invoke thought more than having definitive answers. So to our panelists, we have received a question, and I would invite you to share your thoughts. It is from Nahashon Adihambo, who asks, the new context, quote unquote, new normal is very alienating, more so in cases where strong community level engagement is key. How do we embrace the new normal meaningfully without leaving the communities behind, given the technology access challenges alluded to? is it time to invest more in building community level movements, which has sort of been answered, but I'll open up. Crystal, if we could start with you, and then Nana, if you have some reflections, and then Renee.
Thanks, Claire. And I think this is a really great question, and it's something that I've been grappling with. This idea that virtual spaces will be the silver bullet that helps us, come together, have collective action. And I really don't think it is. I think it's a useful tool for sure, but I don't think it's the only one. And I'm inspired by, you remember when Sudan was going through the revolution, and I was speaking to somebody who was part of the revolution, and I was like, well, how did you manage? And, at a point where they shut down all the internet, there's no social media. And she was like, well, what people don't know is that they had like 7 years of ground work, making sure they had communities that were engaging. So she was like, it doesn't matter if they switched off the internet. We were community. We were all connected beyond technology, beyond our mobile phones. It was at a community level, at a neighborhood level. And so I think we really need to go back to that. And I think COVID is really pushing us in so many different forms and reminding us that real change will come on the backs of real community building and relationships with ourselves. The work that we do is deeply, deeply personal. The work that we do, the political is a personal. And so we have to go back to that very community, very neighborhood-led work and mobilizing for us to change. Definitely social media platforms, Zoom, all these things, TikTok, all of these things are important for sure. But it really is a constant reminder, and the pandemic is constantly banging on us from, making sure we're helping older people and doing shopping for them, making sure they're okay, right all the way up to advocacy work. I think, thank you, Nahasha. Did I get your name right? I think so, for that question. So that's what I think. And I think there's hope. I think there's more people who are more connected in a deeper way, even if, we're only working together, we're not best friends forever, really, but there's relationships that are forming in more meaningful ways. And I hope that we can spark more of those, and spark more of those that can stand the test of time outside of virtual spaces.
Yeah, I agree. I totally agree. I mean, I believe that we really need to, I wouldn't say build, because it's there. The community movement is there. It has always been, even before we started NGOs. We had our community groups, and they were doing, they were working on issues. So I think what this has done is to bring the awareness for us to really connect, or go back. In Ghana, we have, within the Akan ethnic group, there's a symbol where you have a bird looking behind it and taking an egg from its back, and it's called Sankofa. Sankofa means go back and take it. So it really is, we need to go back to our roots. I know it's easier said than done, but we have to make a deliberate effort to make that connection between the movements and the activism that we do on the key issues, and connecting it to the communities on the ground, who really this whole work and everything that we do is about and for, including ourselves. And to use community structures, so market women's associations, fisher folk, the traditional leaders, the religious leaders, the community leaders. How do we make them a part of the movement? And then in doing so, because again, we are talking about COVID and how we are able to work within this space, discuss amongst ourselves, what do we do and how do we do it? Because again, if you look at our traditional ways of mobilizing, there's a lot of physical engagement. So we have to find the ways of still being able to engage, but perhaps work in the kind of avenues and spaces that prevents us or protect us from being infected. So these are some of the things that we need to, but we need to do it together. We can't sit in the cities and in our organizations, and not really get down and connect and work with different groups at that level. So yes, I agree with the suggestion that was made, the question, which I believe she answered, that we can really do this and continue to engage and advocate, even in this time where there are challenges with technology, working through the communities. But we, of course, have to take into consideration the fact that we are within the COVID, we're working within a pandemic context. So that has to be taken into consideration.
Thank you very much, Nana. Renee, over to you.
Thanks so much. That's a good question about working in communities. One thing that is very clear to SIP as a donor is that it's time to recalibrate. Everyone is pivoting. I mean, that has been the most popular word used all of 2020, pivoting. And the suggestion that I will share today with the implementers, the technical assistance programs, is that it's time to have honest conversations with donors, speaking to what is actually achievable within a short-term time horizon and what is achievable over the long term, and not being afraid of the fact that you might not get that income to actually achieve that long-term approach to work, because it's very important to start thinking as a collective as well. Because one thing that one organization can do can only be built on by another. And that collective approach to work is key. And I love what Advocacy Accelerator is providing for us, because that structure is going to see itself through this effort. And I think the last thing I will say is that we also need to be honest when it comes to our advocacy and technical support in terms of what can be attributed to our effort, or what is our contribution to said effort. And I think having those honest monitoring and evaluation conversation helps to then inform a phase 2 or a phase 3 approach to work. So that would be a solution or framing that I would suggest for us as we design our advocacy efforts going forward. Thank you.
Thank you very much, Renee. A number of questions have come in, and we are now in the final stretch of this webinar. I know, Crystal, you have to go, so I'll start off with you, Crystal. If you could respond to a question, what additional risks and or unexpected opportunities did COVID-19 create, and how have advocates responded? You can also focus that on a particular sector if you would like, because we know there's a lot of diversity in advocacy. Please also share your final remarks, because I know that you have to go. To Donnelly, there's a question for you. Did the research for the report discover any new ways to measure meaningfully, particularly while physical distancing? Thank you, Miles, for that question. Donnelly, if you'll go next. Renee, there is a question for you from Ruth, which is, how has COVID-19 impacted the donor landscape for advocacy in Africa? Please also share your final remarks after you have responded. And then one question for you, Nana, is what opportunities are there for technical assistance provision for advocacy now that COVID has brought such great disruption? And if you could also share your final remarks when you respond. Thank you very much for those questions, and thank you to the panelists for giving it a go.
Thanks, Claire. So I'll speak from a very personal perspective on the risks and the opportunities around the last year of COVID that we've gone through. And I think for me, I think it was just a time that, we were just forced to stop in so many ways. And life before was just running around, going from meeting after meeting, trying to catch up with work at the airports or, on the sidelines of meetings. And I think we've been able to stop and really come back to ourselves. And I really, really like Nana's definition of Sankofa. I'm going to be reading that this evening. Thank you, Nana. I think we've just had to go back to ourselves and go back to what's important and meaningful, and self-care in that way that is not, this fancy word of the day, this jargon thing that people use, but really it's just finding ourselves again and regaining the energy to continue the work, I think has been the biggest opportunity. In terms of virtual spaces, as much as I've done a little bit of critiquing of the space, it has also meant that we have access to people that we don't always have access to. Ministers of finance in my space where I work on economic justice, heads of states, policymakers that we don't usually have space and chance to have an interaction with, because everything is so virtual. We've had the space to engage. Whether that's been meaningful, I guess, is the next step of measuring what that looks like. So I think that was for me. I feel a lot more re-energized. I feel a lot calmer in the work that I do, which I think is a good thing. And I think that sentiment will be shared with a number of people. Of course, there's, funding, madness and changes around that. And that's been hard to navigate for a lot of people. As my closing remarks, I'm really excited and really humbled to be part of this amazing group of people that were asked to give feedback and to speak on the report that's being launched today. But what it also reminds me is that as much as the work is so hard, and sometimes just a glimmer of hope and that silver lining is so hard to find, because it's more of a marathon than a sprint. Our wins are not very easily attainable and not very readily available. But I'm in good company. I'm in such good company of such amazing African women, especially for me, who's in a feminist space. I'm in good company of people that re-energize me, make the work and the burden a little bit easier, a little less crazy, that I can rant to. And I think spaces like this, organizations like the Advocacy Accelerator that have such a bird's eye view, and it's really helpful in making sure that we're all like coming together, because this idea of working in silos really doesn't work, but we still keep doing it. I don't know why. So yeah, my closing remarks is that I'm in good company, and thank you for having me. And I really look forward to 2021, where I'm working with a lot of people on this call who I've worked with before, and I look forward to working with many more.
Thank you very much, Crystal. Donnelly, over to you. And thank you for being part of the panel. We really appreciate you and your inputs. Thank you. Donnelly, over.
Thank you for that question. The answer to the question is basically a no. From the research, we were just able to, collect information around some of the challenges that advocates are facing in terms of measuring advocacy engagements online. But then we did not go deeper into trying to understand what are some of the examples that they're actually using in terms of, measuring the same virtually. And it was our hope that some of these webinars will be able to, elicit some of this discussion in terms of getting some of the examples from advocates for them to share what they are currently doing. So the report was about just to, provide that base for us to start those conversations, to get some of the examples that are being used by some of the advocates, and also some of the recommendations that TA providers can actually provide. Thank you.
Thank you very much, Donnelly. Over to you, Renee.
Thanks so much. So when it comes to COVID and donors' response, I would say three things. It's all about fewer, better programs, looking at cross-sectoral approaches. So being more intentional and more targeted is key. And of course, COVID has ignited a more concerted pull towards bilateral engagements. I mean, there've been very quick and fast conversations that have been happening, so we can move the policy and service delivery needles faster. So governments have been embracing the donor community quite some, obviously because of the huge financial need to actually be able to manage COVID. as well as at the same time offer essential services when it comes to the health sector, as well as other sectors, nutrition included. So there's need to facilitate a more local iterations of this work, a more locally inspired lens, leveraging community and key influences. And that's really what's on our radar in terms of our response to development needs. My closing remarks are, I hope that this forum is going to build into something more long-term. I'm really excited about having a community of practice model that we can leverage as a partner in terms of achieving the change we want to see on the ground as a collective. So really excited for that. And kudos to Advocacy Accelerator. This is the beginning of great things to come. So looking forward to further engagements around how we can actually push the needle faster, longer, and really have that systemic change happen. So thank you so much, Claire and team.
Thank you very much, Renee. Nana, over to you.
Thank you. I think my question was on what opportunities exist for technical assistance support to civil society organizations working in advocacy. There are a number of, in this time, there are a number of online training programs that are available. WACSI does provide, but there are several others on resource mobilization, on different ways of advocating in these times. Looking at issues around digital security, leadership. You know, if you're a leader in these times, you need some special skill as well in how to navigate. And so all of those things. There are also resources available, knowledge resources, social accountability, a guidebook on alternative funding mechanisms, how you can build your own. You can build your capacity in these areas to raise other funds from other areas or diversify your resource base. Tech support, and so technology support as in the training on what kind of tools you need and how they will be helpful. But in addition to that, software donation access for civil society organizations. We mainly provide that for West Africa, but for example, in East Africa, KCDF also provides that kind of support. We are all part of a global network called TechSoup, which supports civil society organizations with tech capacity. So hardware, software, as well as the skills and the knowledge to use that. These are all some of the different things that are available. And what I could do is perhaps share some of the resources with the Advocacy Accelerator so that you can share it with participants who registered to be part of this and also broadly, so that people can take advantage of it. So those are a few of the examples, and I just wanted to say in conclusion, thank you for this opportunity to discuss this, and I believe we need to have many more of this that really looks at the solutions. So we've got the evidence, and we've discussed how do we then, what are some of the practical things that could be done? And so, for example, a webinar engaging community activists to look at what are some of the practical ways that advocates could use community networks to advocate better and engage within this pandemic context of a pandemic. So those are some of the things that I hope the Advocacy Accelerator will continue to lead on, so that we can really get things done out of it. For me, one of the things that I know COVID is not a good thing, but one of the things I'm happy about when it comes to COVID is that I think people have heard about how important it is to strengthen the institutional capacity of organizations that do the work that we do. Because if they are not strong, when crisis hits, they will fall. And it doesn't matter how good they are at the work that they are doing, or even the achievements that they are chalking, it just sends everybody backwards. We retrogress. So I hope that donors, I hope partners, everything that we are doing, we would look at the projects, the programs the results that we want, but in doing that, also strengthen the organizations that are doing this work. And particularly for the Advocacy Accelerator, advocacy organizations and the work that they do. Let's make the institution strong. And for Africa, it is important for us. Very, very important. So thank you very much.
Thank you very much, Nana, for that, and for the solidarity, also the encouragement, but also the very wise words on how we need to learn from what has happened, but also move forward. We have gone over time by 6 minutes. We ask for your understanding as we quickly just close off. I would like to ask Boy, who is the Executive Director of the Accelerator, to very briefly do thanks, and then we will close. Over to you, Boy.
Our distinguished speakers, Crystal, Nana, and Renee, and the Advocacy Accelerator team, our guests, our participants, good morning and good afternoon. I would like to extend my heartfelt appreciation to all of you for your attendance and participation at the launch of the Impact of COVID-19 on Africa report. COVID has significantly affected the world at large, and nothing seems to be normal anymore. Our way of doing business has significantly changed. The COVID impact has been felt in every sector, and so is the case on the advocacy space in Africa, as shown on the report which we launched today and as articulated by our speakers. We hope that the report which we launched today will go a long way in supporting and guiding advocates and technical assistance providers as they continue to thrive and embrace the resiliency spirit during these increasingly challenging circumstances. We are grateful to our speakers for taking time and preparing to be part of this timely conversation today. And lastly, I would like to thank the Advocacy Accelerator team who worked so hard to put together this report, organize the webinar, and making this launch a success. Without taking more time, I would like to say thank you to all of you. Over to you, Claire.
Thank you very much for that. And in just thanking and acknowledging and appreciating all those involved in the report, we are very appreciative of all those who completed the survey and gave us and responded so that we could put this report together. As we come to the end of this launch, it is clear that COVID-19 related challenges and prior existing issues that affected CSOs and advocates raise the need to examine what we need to do going forward as a collective. And this has really been highlighted by the panelists. We hope that the report will drive discussion, debate, and action as a result of understanding the impact of COVID-19 and the pivots that were necessitated and continue to be necessary by the pandemic. The African advocacy ecosystem was riddled with challenges that include the capacity for advocates to do their own work being weak, the lack of a knowledge base on advocacy in Africa by local actors, and all mechanisms to have locally driven advocacy strategies in Africa not being in place. This has resulted in the multiplication of externally driven advocacy, which stifles peer-to-peer knowledge exchange due to power dynamics, as well as the restriction of the contributions of grassroots-based advocates. These challenges, systemic in nature, continue to limit the potential growth and opportunities of an advocacy ecosystem in Africa. The need to strengthen this infrastructure remains high factoring in locally based advocates. Lastly, I hope the report emphasizes the importance of promoting locally driven advocacy work to achieve sustainable development goals in any country, and the need for investment in country-based leadership in advocacy and accountability. I thank you, and I hope you all have a wonderful day, evening, and afternoon.